Dr. Asif, you can repeat. What is the structure passing through the parotid gland?
Yeah, that is a facial nerve, retromandibular vein, then a auriculotemporal nerve, and external carotid.
Okay. And parotid gland getting blood supply from which artery?
External carotid artery.
And uh, parotid duct, where it opens?
Upper second molar. Upper
Opposite
second
upper
molar.
word.
Yeah.
And submandibular gland?
It's in the
Lateral to
floor.
lingual uh,
Mm-hmm.
flare, something like that. Lingual,
Frenulum.
Lingual
Frenulum.
frenulum.
frenulum,
Yes,
frenulum.
yes. Very good.
Both sides of
Very
the
good.
lingual frenulum, floor of the mouth.
Yes. Excellent.
Mm-hmm.
Excellent. And now about circle of wheels. Both of you
Yeah.
can explain circle of wheels.
Okay.
Yeah. How it forms?
You want to explain, Dr. Asif?
I can try.
Yeah, go on. You go first.
So vertebral artery,
Hmm.
both arising from both sides, and there that forms a basilar artery. Basilar
Hmm.
artery will give two branches on both sides that are posterior cerebral artery.
Hmm.
And from front, anterior communicating is coming from both sides, and sorry, anterocerebral artery is coming from both sides, and that they are interjoining with anterior communicating artery. So posterior
Hmm.
communicating and anterior communicating both are coming together to form the circle. Am I right?
Yeah.
Mm-hmm.
Correct me if I'm wrong.
No, no, it was okay. Correct. You can repeat again very rapidly.
Okay. Me.
Yes, yes, Dr. Jania.
Oh, okay. Yeah, yeah. So we have the two vertebral arteries, which are the branches of the subclavian artery. They pass from the foramen magnum, and then at the level of pons, they join together to form the basilar artery. Then the basilar artery, it gives off the branches, superior cerebral artery, posterior cerebral artery, and then the internal carotid artery, it gives rise to the posterior communicating artery, middle cerebral artery, and anterior cerebral artery. They all anastomose, and then they form the circle of Willis.
Yeah, good, good.
Mhm.
Vertebral artery, at which level they enter into transverse process?
Transverse process.
Vertebral
Oh,
C6.
these.
C6, C6, yes.
Yeah.
Common carotid artery, where they bifurcate,
L1, L4.
not accepted properly.
Oh no, oh no, that must be abdominal aorta. Sorry.
Dr. Asif, you want to
Sorry,
correct?
sorry.
So,
So,
you are partly correct, but not fully. If it is part B, you
Mm-hmm.
will get a half mark.
common carotid at the bifurcation at the level of, uh, oh
L4,
my
but
God.
L4, you need to be specific. L4, which L4? Where L4? I mean, L4, they have upper border, lower border. So be specific.
L4 is correct.
L4, but L4 also correct, L3 also correct. It is L4. Are
No,
you
you
sure?
said common carotid. You did not
Yeah.
say iliac.
I asked common carotid. Why you are saying L4? You want to take carotid artery in lumbar region? Very
No,
shocking.
yes, I was wrong. I realized it immediately that I was wrong. So I wanted to
Yeah.
come up.
So
C4?
C4, but which C4? C4, lower
C.
border, upper border. Yesterday we
Upper
said
border of C4.
yes. Upper border of C4 and lower border of
C3.
C3. Lower border of C3 and upper border of C4. Okay.
Carotid
Okay.
artery bifurcates. Okay. Common
What?
carotid artery bifurcates.
Okay. What is the mm, nerve supply of tongue? Nerve supply of tongue.
Nerve supply of tongue, anterior two-third is lingual and chorda tympani facial. Posterior one-third is glossopharyngeal and the root is vagus.
Because if you want to make it more
Easy.
perfect, yeah,
That is the way you showed 5, 7, 9, 10, 12.
yes,
That's how I remember.
yeah. But it is better to remember general sensation and special sensation.
Yes.
Yes.
Special
Okay.
Mm-hmm.
sensory, yeah.
So general is lingual
Mm-hmm.
and special is chorda tympani in the anterior two-third and
Very good.
posterior one-third is the
Mhm.
general and special both glossopharyngeal.
Excellent. If you answer
Yeah.
like this in part B, you will get the highest mark and full mark. I guarantee.
Yeah.
So your level is now for MRCS Part B, not Part A. Very good.
Shall I skip
That's
it?
good.
Shall I skip it?
I wish you can, but I'm not the
Congratulations.
authority. Okay. Now, thyroid gland, because if you can uh, explain blood supply of thyroid gland. So you
Difficult one.
mentioned, yeah, artery supply and venous drainage, both you need to cover.
The
Mm-hmm.
thyroid gland, the blood supply is coming from superior and inferior thyroid arteries,
And their branches, superior
which are
thyroid
crossing.
artery.
Mhm.
Superior thyroid artery is the branch of,
Crosses. I forgot. I need to check.
External carotid artery.
yeah,
External, yeah, correct. Actually.
external carotid artery. And inferior thyroid artery,
Is a branch of thyrocervical trunk of the subclavian artery.
yes, very good.
Mm.
And in 10% people, there could be a variation,
Artery, thyroidema.
yeah, thyroidema. And
Thyroidema.
if it is present, from where it arises,
That I remember.
yeah,
Brachiocephalic trunk or aorta.
brachiocephalic trunk or aorta. And venous drainage,
Venous drainage is superior, middle, and inferior thyroid veins. Superior and middle thyroid vein they drain into the internal jugular vein, and inferior thyroid vein it drains into the brachiocephalic vein.
very good, very good. And what is the ring level? I mean, what is the ring level of isthmus
2, 3, 4.
C2 to C4.
and base?
4, 5.
Okay, the toughest question. How many parathyroid glands are there in human body?
4. Two
For
pairs.
what?
Okay, explain content of carotid sheath.
Common carotid artery, internal jugular vein, and vagus nerve.
And their anatomical position.
Uh,
VAN,
oh,
vein artery nerve, medially artery,
Medially artery. So laterally will be
medially vein,
internal jugular vein
vein,
and medially will
posteriorly
be
vagus.
common carotid and
vagus nerve.
posteriorly nerve, vagus nerve.
Hmm. Okay.
Okay, what are the nerves could be injured during submandibular gland surgery?
Oh, marginal mandibular nerve, lingual nerve, hypoglossal nerve.
Yes, very good. Okay, okay, Dr. Asif, you can answer what are the branches of external carotid artery?
External carotid artery. I didn't read this actually. Now I'm passing to Doctor. Any doctor.
Now I know she can answer because she is ENT people. They must know.
Yeah, really.
Otherwise she should lose her job. Okay.
Oh, she's
Yeah.
ENT.
Yes.
Yeah.
Nice, nice. Superior
Yes.
That is
thyroid,
why.
I can say.
You haven't seen me in abdomen, Dr. Asif. Oh my God, you haven't seen me in
Oh,
abdomen
okay.
when we were doing abdomen.
Mm-hmm.
Okay. Yeah, doctor,
So
you can
external
answer.
carotid artery is superior thyroid artery, lingual, facial, posterior auricular, occipital, and ascending pharyngeal. And then it continues as maxillary, superficial temporal.
Yeah. They terminate by dividing into maxillary and superficial temporal.
Hmm. Hmm.
And then what are the branches of the internal carotid artery?
I think Dr. Asif can answer this
No,
now.
no, no. You can
It's
answer.
his turn.
Not yet.
You can
Not
answer.
yet.
Okay,
Continue,
so
please.
internal carotid, posterior communicating, anterior cerebral, middle cerebral, and anterior choroid.
And you missed the first one. What is the first branch of internal carotid artery? This is direct question. What is the first branch of internal carotid artery? Which is the end artery?
Of
Yeah, yeah. It is ophthalmic
ophthalmic
artery.
artery?
Yes, ophthalmic artery.
Mm.
Ophthalmic artery.
Ah, yeah, 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 yeah.
Ophthalmic
Hmm.
artery passes through which foramen?
Oh my God. Optic canal.
Canal. Mm.
Okay, so ophthalmic artery with optic canal and ophthalmic vein.
Superior orbital fissure.
Okay. Hmm. What are the nerves are at risk during carotid end arterectomy? Nerves at risk during carotid end arterectomy.
Lingual, hypoglossal, and vagus.
Hypoglossal and vagus is correct, but lingual will not come here. Lingual actually anterior branch, anterior, and carotid will remain in the lateral side. Okay, so the hypoglossal will come, vagus also will come, and just remember the area: greater auricular and superior laryngeal. These four nerves. This is also exam question. Hypoglossal, vagus, 910, 910, vagus, hypoglossal, and greater auricular, superior laryngeal.
Okay, superior laryngeal nerve.
Hmm.
I didn't know this nerve exists. I thought it's external laryngeal and recurrent laryngeal.
Superior laryngeal also there.
Okay. Okay.
Okay, middle meningeal artery. This is the branch of.
Middle meningeal artery, maxillary artery.
Okay, what are the branches of subclavian artery?
Vitamin B and BC. So vertebral artery, uh, oh my God, thyrocervical, costocervical. Uh, why do I keep forgetting this?
Internal thoracic artery and
Internal thoracic artery,
and
thyrocervical trunk,
and D for
CG, dorsal scapular, dorsal scapular.
dorsal scapular artery. Yes.
Yeah, vitamin C and D. Oh, it's not B. Vitamin C and D. Yeah, yeah. Dorsal scapular. Yeah, internal thoracic. Yeah.
Okay, good. You did very well. Both of you did well. Now we will
Thank you.
proceed. Yeah, you can see the screen.
It's loading now. Yes, now I can see the screen. Yeah.
Okay, so we will start with cranial nerve and we'll finish. Almost you are done. Cranial nerve for part A, not very important. Just remember very few. Remember name of the 12th cranial nerve and optic nerve.
Hmm.
Mm.
Hmm.
Oculomotor. Remember this one. You all know this. SO4
Yeah.
LR6.
Super
Okay.
elastic
LR6.
respiratory.
Yes. This all
Question also
the
came na in the exam, in the
eh,
today's
eh,
mock.
Yeah.
I
Hmm.
remember with that.
yeah,
Yeah. LR6 it was, isn't it?
Mhm.
LR6. Lateral rectus.
Hmm.
Trigeminal nerve already we have seen. Mandibular branches has
Largest
both
cranial.
sensory and motor fibers. And this is the largest cranial nerve.
Hmm.
Trigeminal is the largest cranial nerve.
Hmm.
And this is the largest cranial nerve, but abducens nerve has the longest intracranial course. That's why if
Hmm.
there is any raised ICP, intracranial pressure, abducens nerve get compressed. Okay.
Hmm. Hmm.
Facial nerve, it controls muscles of facial expression and taste from anterior two-thirds of the tongue by
Hmm.
chorda tympani.
For the dampening. Hmm.
Okay. Vestibulocochlear,
Hearing.
yes.
Doctor, excuse me, this lecture is here in the given to us.
Mm, yeah, I think it is shared in the group also.
That MRCS final that there though.
This one, I think head and neck lecture old final. Old final. If it is not there, I will again post. If you have Dr. Zania, you can post also.
Yeah, I have
EM,
it. I will
EMRCS
send it.
final, I think I can see
Oh,
next.
okay, no problem. We can again share in the group.
A bit.
She will share, no problem.
Mhm. Thank you, thank you,
Yeah.
thank you. I'm having a bit different.
Hmm.
Okay, okay. Now, accessory nerve,
Okay.
it
Yeah, sorry
supplies.
for interruption. Yeah.
No, no, no. Accessory nerve, it supplies trapezius and sternocleidomastoid.
Hmm.
Cranial nerves carrying parasympathetic fiber 1973. 1973. So if we divide it, we have 9, 10, then
Hmm.
7 and 3. 3, 7, 9, 10. Actually. The sequence should be 3, 7,
Hmm.
9, 10. 3, 7, 9, 10.
Hmm. Hmm.
Number 3,
Hmm.
parasympathetic functions served by the cranial nerve include number 3, oculomotor and pupillary constriction and accommodation. Then facial
Hmm.
nerve, lacrimal gland, submandibular gland, sublingual gland, glossopharyngeal over the
Hmm.
parotid gland, and vagus nerve over
Hmm.
heart and abdominal viscera. Okay.
Hmm.
Optic nerve carries no parasympathetic fiber. Just you will get single stem, true or false, like this.
Okay.
Trigeminal nerve. Trigeminal nerve is the main sensory nerve of the head. Just one a statement, true or
Hmm.
false.
Hmm.
Then distribution of the trigeminal nerve, sensory, motor, and autonomic connection. Sensory, where they
Hmm.
give distribution more, just have a look and their distribution. we need to remember upper lip
Hmm.
is
Hmm.
by maxillary, but lower lip by mandibular. Okay.
Hmm.
Tip of the nose by V1, though it is ella of the nose is by V2, but tip of the nose
Wait.
is by V1. Tip of the nose by V1. Here again we have seen before V1, that is ophthalmic by superior orbital fissure, maxillary, foramen rotundum, and foramen ovale,
Hmm.
mandibular.
Hmm.
Muscle, facial nerve, where they supply. Okay,
Dr.
these are
Asif, I think there is a lot of background noise at your end.
Yeah, sorry for that.
Is it, if you can mute yourself, please,
Yeah.
during the lecture. Thank you. Yeah.
okay. So now facial nerve
Hmm.
supply face, ear, taste, tear, face, ear, taste, tear,
Taste and
face,
tear. Hmm.
musculofacial expression, ear,
Hmm.
nerve to stapedius. This is
Hmm.
important and exam question. Facial nerve, nerve
Hmm.
to stapedius. Then taste, anterior two-third of the tongue, and tear,
Hmm.
parasympathetic fiber to lacrimal gland, also salivary gland.
Hmm.
Facial
Hmm.
nerve, their pathway. This is important, very important. In
Okay.
subarachnoid, in subarachnoid path, they origin from the pons. Okay,
Hmm.
passes through the petrous temporal bone into the internal acoustic or auditory meatus, along with
Hmm.
vestibulocochlear nerve. The 7 and 8, they pass through internal acoustic meatus. This is also exam question, or a same you will get. Which of the following nerves exit the skull together with the same foramen? Facial nerve and
Hmm.
vestibulocochlear nerve. So 7 and 8, they pass through both internal acoustic
Internal
meatus.
acoustic meatus.
Yeah.
Hmm.
So they are now exiting through the internal acoustic meatus.
Acoustic
Fish,
meatus.
then facial canal path.
Hmm.
The canal passes superior to the vestibule of the inner ear. At the medial aspect of
Hmm.
the middle ear, it becomes wider and contains the geniculate ganglion.
Hmm.
Then it has three branches. This is direct exam question. What
Hmm.
are the branches of the facial nerve in facial canal?
Greater
I
petrosal nerve to stapedius and chorda
yes,
tympani.
I remember it like CNG, compressed natural
Hmm.
gas, or in our country we have CNG,
Hmm.
CNG auto rickshaw or
Hmm.
something. CNG. C for chorda
Yeah.
tympani,
Yeah.
N for nerve to
Hmm.
stapedius, and G for greater petrosal nerve.
Greater petrosal. Hmm.
Greater petrosal nerve, nerve to stapedius, and chorda tympani. These are the branches of the
Hmm.
facial nerve in facial canal.
In the facial canal. Hmm.
Yes. And then stylomastoid foramen passes through the stylomastoid foramen. Okay. Then they
So these
enter into
diagrams
the,
are exam questions, right?
yeah, yeah. This is very important. Facial nerve, trigeminal nerve, optic nerve.
Mhm.
Uh, these are important.
Okay.
Then in the face. Now they are entering into the face. You know this one.
Face.
That in the parotid gland,
Yeah.
they divide
Five
into
branches.
different branches. Yes. The zebra, pugger, my cat. The for T for temporal branch, zygomatic branch, buccal branch, marginal mandibular branch, and cervical branch.
Deep cervical.
Yeah. Temporal, zygomatic,
Temporal, zygomatic, buccal,
buccal,
mandibular, and cervical.
marginal mandibular, and cervical.
Cervical branch.
There is two mandibular. Remember yesterday we discussed one is marginal mandibular, another one is mandibular division of trigeminal. So
Trigeminal
both.
nerve.
Okay.
Hmm.
See here,
Okay.
facial nerve coming, then okay, they are different branches. No need, no need. Now vagus nerve. Vagus nerve,
Mm.
they develop from fourth and sixth pharyngeal pouches. Vagus nerve develop from fourth and sixth pharyngeal pouches. And parathyroid
Mm.
develops from which pouch?
Third and
Arches?
fourth.
Third
Third
and
foot.
fourth. Third and fourth pharyngeal arches. Okay. And vagus from fourth and sixth. Actually, there is no fifth pharyngeal arches. Fifth one
Mm.
fused with sixth. Okay.
Mm.
So we have 1, 2, 3, 4, and 6. So vagus
Mm.
origin from fourth and sixth pharyngeal arches. Then it arises from the lateral surface of the medulla oblongata by a series of rootlets. Vagus is very important. I consider it one of the important nerves of our body. All are important, but vagus
Mm.
is the essential one.
Very important.
Yeah.
Mm.
And vagus, it exits through the jugular foramen. Remember, guava, G, V, A, 9, 10, 11.
Yeah.
In between
Yeah.
inferior petrosal sinus and
Petrosal sinus and sigmoid sinus.
sigmoid sinus, and they form
Internal jugular vein.
internal jugular vein. Okay. They exit through. Who is getting called? Is it from my side? I'm getting a call or who?
No, not me.
Me also.
Okay. Okay. Okay.
Let me check. Call from who? Sorry.
I don't know. I checked in my phone also. We can proceed. Vagus nerve.
Is it Sanjita? Maybe. Okay.
Okay. Vagus nerve arises from the lateral
Mm.
surface of the medulla oblongata, and they exit through the jugular foramen.
Mm.
Okay. In the neck, it descends vertically in the carotid sheath. It leaves the neck
Mm.
and enters the mediastinum.
Mm.
On the right, it passes anterior to the first part of the subclavian artery. Remember,
Mm.
anterior to the first part of the subclavian artery. So if it is with subclavian,
Subclavian
mhm, it passes
artery.
anterior to the first part of the subclavian artery. On the left side,
Mm.
it lies in the interval between the common carotid and the subclavian artery. These are
Mm.
very, very important, and they give which of the following is true about vagus nerve or false about vagus nerve. So we need to remember these facts. So
Mm.
in the neck, we have seen they remain in the carotid sheath. This is vagus nerve. Okay,
Mm.
this is vagus nerve, and they are remaining within the carotid sheath. This is
Mm.
jugular vein, a common carotid, and
Internal
this is
carotid.
vagus.
Mm.
Yeah.
So
Mm.
in the
Common.
right side, they are passing along with subclavian artery. anterior to the first part of subclavian artery. On the right side, it passes anterior to the first part of the subclavian artery. On the left side, it lies in the interval between common carotid and subclavian artery. So from the neck, now it is entering into the chest, or we can say it mediastinum. Okay. In the mediastinum, both vagus passes posterior inferiorly and reach the posterior surface of the corresponding lung root. Very important, everything. In the mediastinum, they remain in the posterior inferior aspect and reach the posterior surface of the corresponding lung root. Means in the right side, the right lung, left side, left lung root. They remain posterior. Vegas remain posterior. This is also exam question you will get. In many EMRCS, you will get this question. These then branches into both lungs. At the inferior end of the mediastinum, these plexus reunite to form the formal vagal trunk that passes through the esophageal hiatus. You remember esophagus and vagus.
Esophagus, T10.
Esophagus and vagus.
T10.
Yes, there they pass as like vagal trunk. Okay. In the posterior mediastinum, in the inferior aspect, they form the vagal trunk that passes through the esophageal hiatus and enter into the abdomen. The anterior and posterior vagal trunk are formal nerve fibers. These then splay out once again, sending fibers over the stomach and posteriorly to the celiac plexus. Branches pass to the liver, spleen, and the kidney. So see their power, vagus nerve power. It is coming from the medulla oblongata. In the neck, it is remaining into the carotid sheath, then entering into the mediastinum, remaining posterior to both lung root. Then with the esophagus, it is coming to the abdomen. Then in the abdomen, it is going to stomach, spleen, kidney, liver, and celiac plexus.
So I think the longest is vagus, then not trigeminal, no?
Intracranial longest is abducens. Okay. And oculomotor is the longest. Again, I am confused. Largest.
Not the longest.
But not the longest.
Maybe thick.
Largest, yeah, thick. Trigeminal. It is a very big root. Free root. You can check and then you can post in group.
Okay.
Longest nerve, shortest nerve, thickest nerve. So vagus you can read again and again to get the maximum. Okay. Communication and branches. Superior ganglion, inferior ganglion branches, superior and inferior cervical cardiac branches, right recurrent laryngeal, left recurrent laryngeal, thoracic and cardiac branches. I read this thing in details from that and another lecture file. I found that one relatively easy. You can also try, but you need to read in details. Vagus nerve. Vagus nerve is a must.
Okay.
You have to read all. Recurrent laryngeal nerve. Yeah. I try to remember from this picture. This is a summary.
Okay.
See, inferior vagal ganglion. Both sides. We can see only one side. Inferior vagal ganglion, superior laryngeal nerve. They are coming. From inferior vagal ganglion, we are getting left
Superior laryngeal
vagus.
nerve.
Yes. Also left vagus nerve. Left vagus nerve. And we have here superior laryngeal nerve. From superior laryngeal nerve, we have two branches. One is internal laryngeal nerve, another one is external laryngeal nerve. So see, internal laryngeal nerve, external laryngeal nerve, and left vagus nerve. All root are coming from inferior vagal ganglion.
Inferior
Vagal
vagal
ganglion.
ganglion.
Yes. So again, inferior vagal ganglion giving branch to superior laryngeal nerve, which giving branch to internal and external laryngeal nerve, and one large vagus nerve. Then
Vagus
vagus
nerve.
nerve along with the carotid artery. In carotid sheath, they are descending down, down, down. In the left side, they are descending down and hmm, sorry. Hmm, yeah. In the left side, see, this is very important. In the left side, it is coming down, 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 anterior to left subclavian artery in both sides. Anterior
Yeah.
to left subclavian artery, then coming down, and here anterior to arch of aorta. Then it is making a loop. Then it is going up, and this is ascending branch. Something going up, and this is left recurrent laryngeal nerve. Left recurrent laryngeal nerve arising from left vagus nerve after arching below the arch of aorta in the left side.
Hmm. Hmm.
But in the right side, same, they are arising from inferior vagal ganglion. Then they are giving to laryngeal nerve, which is dividing into internal and external, and separately
Right
vagus nerve,
vagus
right
nerve.
vagus nerve, right vagus nerve, yes. Right vagus nerve again
Hmm.
in the neck region, remaining within the carotid sheath, coming anterior to right subclavian artery, and just at this level, it is making a loop
Hmm.
and going up as a right recurrent
Right
laryngeal
recurrent laryngeal nerve.
laryngeal
So
nerve.
left has a long route, like it goes down
Yes,
till aorta, and
yes,
right one only till subclavian artery.
yes.
Okay.
And they continue as like vagus nerve. This is also vagus nerve, right, and this is left vagus nerve.
Hmm.
Now,
Hmm.
in the mediastinum, they remain in the posterior of the lung hilum.
Lung route.
This is lung root. In both sides, they remain posterior. Then,
Hmm.
along with esophagus, they form vagal trunk, and then they enter into the abdomen with esophageal hiatus. Now, uh, in many STEM, you will get a patient came with a stab injury at the level of manubrium sternum. This is manubrium sternum. Manubrium sternum.
Hmm.
Which of the following nerve has the less probability of injury? They will give left recurrent laryngeal nerve, right recurrent laryngeal nerve. So which one will be correct?
Right. Right
Right.
recurrent laryngeal nerve.
Because right
Because
one
it
will
is
not
going up,
come. Yeah,
not
yeah.
coming down.
Yes. Right one will finish at this level, uh, at clavicular level, right subclavian artery. And in the left side, it arches the arch of aorta.
Hmm.
Ansa cervicalis root value. We have to remember the root value. Ansa cervicalis
C
cervical 1,
2, 3.
2,
1, 2,
3.
4.
Yeah, 1 to 3. Ansa cervicalis 1 to 3.
Okay. Okay.
They have superior root, inferior root. Superior root C1, and okay, they innervate sternothyroid, and omohyoid, and they give supply from the inferior aspect. That's why the nerve ansa cervicalis lies anterior to the carotid sheath, anterior to the carotid sheath. Anterior to the carotid sheath, ansa cervicalis.
Hmm. Yeah.
This is page number 35. 35. See this picture here. This is vagus in the carotid sheath,
Hmm.
right?
Hmm.
And this is recurrent laryngeal nerve. We need to remember their orientation very perfectly. Recurrent laryngeal nerve will remain in between esophagus and trachea. In between esophagus and trachea, right? This is esophagus and trachea because this recurrent laryngeal actually the branch of vagus, but in right and left
Hmm.
side they are arising from different level. But
Hmm.
mainly they are ascending branches. They are arising from
Hmm.
down and coming up. So
Hmm.
recurrent right and left recurrent laryngeal, both laryngeal remaining in between trachea and esophagus, but vagus
Okay.
remaining within the carotid sheath.
Hmm.
Okay.
Okay. Okay. Okay. So recurrent. So the laryngeal nerves both they remain between the trachea and esophagus, and vagus it is in the carotid sheath. Okay.
Yes. And ansa cervicalis will remain anterior.
Ansa cervical is outside.
Anterior.
Yeah, anterior to the carotid
Anterior.
sheath. Yeah.
Anterior. That's why I mentioned that part. Ansa cervicalis lies anterior to carotid sheath in the anterior triangle.
Uh, Carotid
And
triangle. Yeah. Yeah.
carotid triangle. So now again, see, uh, ansa cervicalis will come like this. Okay. So this is in the anterior triangle. This one
Hmm.
also will come anterior triangle.
Hmm.
So in the neck again, in the carotid sheath we have vagus. In between trachea and esophagus we have recurrent laryngeal and ansa cervical to carotid sheath or in anterior triangle. Anterior to the carotid sheath in anterior triangle. The nerve supply
Hmm.
to the inferior strap muscle enter at their inferior aspect. Therefore, when dividing these muscles to expose a large goiter, the muscle should be divided in their upper half. Muscle should be divided in their upper half to avoid injury of the ansa cervicalis.
Hmm.
Ear anatomy, external ear, middle ear, ossicles, internal ear, lacrimal system, ophthalmic artery, ophthalmic vein, tonsil. This is all. This is all. Okay.
Okay.
So this is all about head and neck. But again,
Hmm.
when you will start to solve EMRCS, you will find many new concept, new questions which
Hmm.
was not discussed in this lecture file.
Hmm.
So
Hmm.
EMRC is also equally important. Okay.
Hmm.
Now today is uh, Tuesday,
Wednesday?
Wednesday, and
Uh,
today is Wednesday.
yeah, Wednesday.
Yeah. Then Thursday and Friday, these 2 days, you have to finish EMRCs.
Thursday, Friday, yeah?
Yeah. Then
Yeah.
Saturday we will have a full mock of head and neck. Then we
Hmm.
will go to our next.
Okay. Will it be thorax, yeah?
Let me show my screen.
So ER is not needed at the moment from head and
Hmm?
neck. ER anatomy is not needed.
Here anatomy,
Ear anatomy.
you can read from EMRCS. No need that much.
Okay.
So this is the benefit you are getting.
Okay. Okay.
I
Okay.
was
Okay.
I was
Okay.
unlucky. I had to go through all. Then after second round or third round, I came to know these are not important. No need to read.
Okay.
Hmm. Hmm. So, Dr. Adhikary, what do you think? I mean, I don't know about the other candidates like Dr. Asif and Sanjida, that are they going to give the January exam or not? I think Sanjida is interested, but she hasn't like confirmed with me. Um, the pace
Hmm.
with which we are going, do you think so that by December we'll be able to cover the rest of the syllabus as well?
See, anatomy is something which you feel interest to study. Okay. Next,
Hmm.
when other topics will come, you will lose your interest. This is the brutal truth.
Hmm.
Then you can
Hmm.
decide after your first round. Then you can decide when you should sit for the exam. Okay. Also, when we will
Hmm.
start our full mock subject finals like mock, then you can judge your preparation. But assuming your current speed, you can target for January. Okay, keep
Hmm.
an eye for the exam opening. I mean center opening.
I
Then
know it's the October 13th or something is the last date to apply.
this is August, September, October. Still, you have 2 months. Yeah, 2 months is enough. By this time, we should finish first round.
Hmm. Hmm.
See,
Yeah, it's better to be
you,
well prepared.
yeah, you can see this question. First question. Can you see on the screen which of the following structure is
No,
not? I'm
no,
sharing
I
the
cannot
screen.
see screen.
PDF. Can't see.
No, I can't see.
Okay, I'm sharing. Can see the screen.
Yeah, loading content now. Yeah.
Okay, so total 368, but 309 pages.
Hmm. Hmm. Hmm.
ভাইয়া
Hmm.
দেখতে পাচ্ছেন? Dr. Asif?
Yeah, I can see now.
Okay, okay.
Correct.
So this is the example of first question. Any one of you can read?
Yeah, which of the following structures is not transmitted by the jugular foramen?
Okay, so jugular foramen. When you get this jugular foramen, I used to do like this guava, GVA 9, 10, 11. Now,
Hmm.
any STEM I can answer easily. So hypoglossal is
Hmm.
number 12. Of course, it will not go through this foramen. Then a little explanation, you read this one. Anterior,
Hmm.
the same thing. Inferior petrosal sinus, posterior sigmoid sinus, and
Hmm.
intermediate 9, 10,
Hmm.
11. Then foramina. Again, the same explanation. If you wish, you can read.
Mm.
Otherwise,
Mm.
there is covered by our lecture file. Then,
Mm.
next question.
Which is the correct embryological origin of the stapes?
Mhm. Second pharyngeal arch. There is no clue, nothing. Just you have to read. Embryology, uh, nothing to understand. Only
Directly
memorize.
remember.
Yeah, only remember.
Mm.
Embryological origin step is second. This step is,
Mm.
I used to remember like this. Step is for
Mm.
second, S is UND. Most of the bone and this thing starting with S arise from second. But we have a
Mm.
chart, pharyngeal arches. Yeah.
Mm.
Now we will see here. Pharyngeal arches say during the fourth week of embryonic growth, it arises from the mesodermal outporching, okay, of the developing pharynx. We are reading pharyngeal arches from where different anatomical structure develops. And when this
Yeah,
pharyngeal arch
more than
develops
once.
during the fourth week of embryonic life. Okay. So
Mm.
pharyngeal pouches from the endodermal side between the arches. There are six pharyngeal arches. The fifth does not contribute any useful structures and often fuses with the sixth arches. Okay.
Mm.
So we have basically one, two, three, four, and six. So number one, how we remember any technique, whatever you can develop your technique. I follow this technique like first T, M, T, M. So T like tensor tympani, tensor palatine, then M, T and M. First is a team, first team. For T for some muscle we got here, and then for M, muscle of mastication, then anterior belly of digestive. Again, these are the muscular contributors. Then skeletal contribution. Again, aim for maxilla, Meckel's cartilage, incus, and malleus. So you can see malleus, maxilla, Meckel's cartilage covering by the M.
Mm.
Then endocrine, no endocrine
Yeah.
from the first arches. Artery, we have see the terminal branches of the external carotid. One is maxillary artery
Mm.
and another was superficial temporal.
Superficial
But but
temporal.
but that one will not come here. External carotid and maxillary. So external carotid, this is external carotid. One is superficial temporal and maxillary.
Mm.
These two
Mm.
coming here.
Mm.
So external carotid
Mm.
and maxillary and nerve,
Mm.
mandibular nerve because it is M. Mandibular nerve,
Mm.
mandibular nerve. So mandibular
Mm.
is which one? Mandibular is
V3.
B3, B3, B3. Now second word we will remember second S. Here also nice. Okay, second S for facial expression. S. See, mastication. M. This is muscle of mastication. M. This M for M. First M. Two type of
Mm.
muscle. One is muscle of mastication and muscle of facial expression. Here is getting priority. So S for this S. Okay, and S for second. In
Mm.
any way, just you need
Yeah.
to remember. Expression is for S. So muscle of facial expression, then stylohyoid, stapedius.
Yes, all right.
Okay.
Making sense, these
Yeah.
arches.
Yeah. 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 So first we got B3,
M
that is
E
mandibular
M.
nerve. Mandibular nerve, right?
Mm.
From the first arch, we got mandibular nerve, we got artery. Which artery? We got external carotid artery, maxillary artery,
Extra carotid
endocrine,
artery,
no
maxillary artery,
endocrine. Skeletal, we have M-related some muscle like malleus,
incus malleus,
maxilla,
Meckel's,
Meckel's cartilage, and
maxilla.
mastication,
Mm.
mastication muscles.
Mm.
And T also we have tensor related, tensor tympani, tensor belli palatine. First finish, then second. Second spelling is for expression, styloid,
Mm.
stapedius. Stylohyoid, stapedius. Most of the time they ask about stapedius. Stapedius from the second.
Mm.
Second and stylohyoid also. Previously we got anterior belly of digestic from the first.
Mm.
So posterior belly definitely will come from the second. Okay. Posterior
Mm.
belly will come from the second. Then as it is S. So S for stapes, styloid process. Okay.
Stapedius, styloid
Stapedius.
process. Yeah, yeah.
There is no endocrine. And again, vascular inferior branches
Stapedial
of
artery fissure.
superior thyroid artery, stapedial artery. S for S, stapedius, so stapedial artery. And S for again S, superior thyroid artery. Okay. And nerve is
Mm.
facial nerve. Nerve is facial nerve. Facial nerve number 7. So again, here also we have almost like the same sequence. Okay. Somehow I developed this one, and believe me, this helps a lot in the exam hall. When you are
Is
under
it?
pressure, when you are under pressure, your brain is not as fresh, or it
Mm.
cannot think uh, wisely. So
Mm.
if you remember this simple calculation, 5, 7,
Mm.
9, 10, you can
Mm.
remember. So it is
Mm.
1, 2, 3, like that.
Mm.
So
Yeah.
it is all about the nerve. So from the first arch, we got
Mm.
5, number 5, uh, especially V3, mandibular division. Then from the second
Mm.
arch, we have facial nerve, that is number 7.
Mm.
Then now we are in the third. So third, stylopharyngeus muscle and their skeletal contribution, thyroid, not very important. From third arch, mainly they make question about the endocrine, because from the third year in our medical school, from the third year we have the endocrinology. Okay,
Thymus
so
and inferior parathyroid. Yeah.
yes, from third arch we have thymus and inferior parathyroid. In third year or in third arch we have inferior. Then when they develop fourth, they have superior parathyroid. First, third inferior level, third year inferior level, then fourth year superior level of parathyroid.
Mm.
So in
Mm.
third year they discuss about inferior parathyroid and thymus. T for T, thymus, T for T, thyroid, thymus, and inferior parathyroid, thymus, inferior parathyroid. Here they have common carotid artery and internal carotid artery.
Mm.
Common carotid artery and internal carotid artery. But external
Internal
already,
carotid artery.
and external was from first.
Well, first.
Yes,
Mm.
first. And now nerve supply sequentially as we finished 5, then 7. Now definitely it will be 9. So from the third arch, we have number 9, glossopharyngeal. Now, fourth arch, we are fourth year medical student. So all
Yeah.
intrinsic muscle of the soft palate, including cricothyroid. Cricothyroid, they develop from fourth pharyngeal arches. And here important, thyroid and epiglottic cartilage also from the fourth pharyngeal arches. And we have seen in third year we studied inferior parathyroid. When we are upgraded to fourth year, we are reading about superior parathyroid. And now we have artery, right subclavian artery and left aortic arch. Right subclavian artery, left aortic arch. Not very important. Mainly from fourth arch, they will make question about vagus. From third arch, they will make question about thymus, inferior parathyroid. From fourth arch, we have vagus. Vagus, vagus, vagus. Okay. Then there is no fifth. We are directly in internship for sixth year. In fourth, we have seen all intrinsic muscle of the soft palate. Soft palate. Fourth year is little soft. Teacher are soft. But when they are in internship, they become hard. Okay. So all intrinsic muscle of the larynx except cricothyroid, because cricothyroid is coming from fourth. Here we have seen.
Fourth.
Yeah. Cricothyroid from fourth. So these are all intrinsic muscle of the soft palate from fourth pharyngeal pouches. All intrinsic muscle of the larynx are coming from sixth. There is no endocrine because already all endocrine we finish in third year and fourth year. In third year we studied about thymus, inferior parathyroid, and fourth year superior parathyroid. In sixth year no endocrine. Artery, right pulmonary, slowly it is coming down. Right pulmonary, left pulmonary, ductus arteriosus. This is exam question. Ductus arteriosus develop from which pharyngeal arches? Sixth. And here we have boss nerve. Because see, Vegas they have in fourth, Vegas they have in fourth, also they have in sixth because Vegas is very vast. Vegas and recurrent laryngeal nerve because recurrent laryngeal is also the branch of Vegas. So I don't know if that necessary. From first arches, we have V3, number 5. Second arches, we have facial. Third arch, we have glossopharyngeal. Fourth and sixth, we have vagus. And from 10th,
Yeah.
especially, we have vagus with recurrent laryngeal. Okay, this will be the last question. Dr. Asif Bhaiya, you can read this question.
Dr. Asif is not in the group, is he?
Uh,
Did he not join?
okay. You can read, doctor.
Yeah. A 73-year-old man presents with a tumor at the central aspect of the posterior third of the tongue. To which lymph node? Uh, to which lymph node? The group is most likely to metastasize. So this is bilateral deep cervical lymph node.
Hmm.
So the anterior third, so the tip is submental lymph node, the
Yeah.
lateral is the ipsilateral,
Mm-hmm. See
and then
here.
the central is the submandibular, like the
Yes.
tongue of the center.
Yes.
Yeah,
Yes.
and posterior is deep cervical.
Mm-hmm. See here, I try to remember it with this picture. From the tip of the tongue,
Hmm.
it goes to submental.
Hmm.
Then
Hmm.
submental drain into deep cervical.
Deep cervical. That's right.
Yeah. Then from the center of the tongue, it goes to submandibular.
Submandibular.
Then from submandibular, it goes to deep cervical.
It goes to deep cervical.
And the lateral, posterior
Yes.
lateral, and the root of the tongue, it directly, uh, root of the tongue directly, it comes in the deep cervical.
Mm.
Okay.
Mhm.
Like this, you can make some announcement in group when both of them or individually them be able to sit together and then
Mm.
continue. We have
Mm.
finished
Mm.
our lecture discussion. Now it is time for
Yes.
EMRCS. So this part, I think
Yes.
you can study by yourself, and you should study in a group, not alone. Believe me, whatever you will study with anyone else, it will be considered as like 10 times self-reading,
Mm.
10 times, and
Mm.
you will remember those things. Other, if you
Mm.
read alone, it is very difficult. I'm saying from my personal
Mm.
experience. I had a,
Mm.
you can say it is my record. I never studied a single line for MRCS alone. Whatever I
Is
studied
it?
with, yeah,
Is-
yeah. I never
Uh,
studied alone.
but but you got the nice group, isn't it? Like the group that is,
It takes time.
motivating you.
It takes time. It takes time to build a group.
Mm.
Uh,
Yeah. Yeah.
Sometimes you need to ask someone. If you're lucky, then you will get someone good. You will get